Good morning, and a very warm welcome to day 2 of CRAN's third annual Pan-Tumor Biomarkers Conference. Welcome back to those who joined for yesterday's sessions, and a warm welcome to our new audience members participating today. We are so pleased to have you join us and learn with us throughout this conference. My name is Cassandra Macaulay, and I am the Chief Research Officer at CRAN. It is my honor to guide you through this conference programming again today. For the benefit of those who were not able to join us yesterday morning, I'll dedicate a few minutes as we get started again today to some introductory and housekeeping remarks. The theme of this year's conference is the future of genomic testing in the Canadian healthcare landscape, overcoming challenges and embracing opportunities for a path forward. We are incredibly grateful for your engagement this morning and looking forward to bringing you another great day filled with remarkable learning opportunities and enlightening discussions. We do have quite a diverse audience joining us throughout the conference, and for the benefit of those just joining for the first time today, I'll take a moment to define some of the medical terminology that you will be hearing a lot about throughout the conference. So when we speak about the word biomarkers, we are referencing a biological marker that identifies a DNA or RNA mutation or an alteration, a protein, or another substance that provides information about an individual's tumor or cancer. Within the context of this conference, as well as within CRAN's advocacy efforts, comprehensive genomic profiling, or CGP, refers to a single test that assesses for hundreds of genomic alterations or biomarkers. And again, they're doing that to detect specific molecular abnormalities within a tumor. I will highlight that there is a medical terminology reference document that is available throughout the conference, and it can be found as a downloadable resource below your video stream. By way of introduction, the Colorectal Cancer Resource and Action Network, or CRAN as we are more affectionately known, originated as a grassroots colorectal cancer information and support group back in 2006, shortly after the passing of our founder's father, who had been afflicted with widespread metastatic disease. Today, CRAN has very proudly become a national, not-for-profit, patient-focused organization. We are governed by an experienced board of directors and counseled by an expert and truly wonderful medical and scientific advisory board. At CRAN, we have 2 patient advisory councils, one of which is dedicated to the under 50 patient population. And our council members' past experiences with the disease really help to inform our program development to ensure that our services are relevant and meaningful. In terms of our mandate, we champion the health and the well-being of Canadians touched by colorectal cancer and others at risk of developing the disease. And we do this by providing support, education, and advocacy to patients as well as their caregivers to help improve quality of life and longevity. Of relevance to this conference, CRAN has expanded our patient-focused mandate, and we do so to serve multiple tumor type patients to ultimately reduce the burden of cancer in Canada, as this is actually our mission. So this event is a part of the Biomarker Conference series, which has evolved over time. The impetus for the conference series actually began in late 2022 after CRAN observed and documented a number of patient-reported challenges and barriers in respect of biomarker testing awareness, as well as access to results in the colorectal cancer space. Upon identifying these challenges and barriers, CRAN reached out to our advocacy partners in different tumor types. And from there, we confirmed that these concerns were not limited to the colorectal cancer population, and that this was truly a pan-tumor issue. As such, our inaugural event in 2023 focused on timely and equitable access to biomarker testing results right across tumor types. Following the event, a publication ensued, and that marked the start of a national collaborative advocacy campaign. Each subsequent year has built on the outcomes of the previous event. And in 2024, our theme was centered on timely and equitable access to advanced biomarker testing. Dr. Gill presented yesterday on the outcomes of this event and the publication that followed thereafter. This year's programming was developed in response to the calls from action from the 2024 event, wherein patients and experts called for publicly funded access to comprehensive genomic profiling. As such, the 2025 event is quite forward-thinking, and it addresses the future of genomic medicine, as well as the implementation of CGP. Our conference series will most certainly continue, and the programming for 2026 and beyond will really be developed in response to the unmet needs that are identified by the pan-tumor patient population in combination with the outcomes and calls to action stemming from this event. So let's explore our 2025 programming a little bit further. We have divided the conference into two distinct themes. Yesterday's theme focused on identifying policy opportunities and advocacy strategies to support the implementation of CGP for metastatic cancer patients in Canada. Yesterday, we shared an update about our national collaborative biomarker advocacy campaign and presented on the outcomes of last year's event. The highlight of yesterday's programming was our keynote presentation, the CGP cost-benefit analysis. All registrants will be receiving access to all of the recordings from this event next week. And if you didn't have the chance to tune in for that presentation yesterday, I strongly encourage you to do so, as it's truly relevant across all stakeholder groups. Yesterday, we also hosted the leads of multiple tumor type patient groups in Canada who spoke to the value of CGP in their respective patient populations and reacted to the cost-benefit analysis. We hosted international genomics leaders, health economists, and policy leaders to discuss implementation challenges and strategies, as well as system readiness. Now, looking at today, our objective is to discuss the clinical and the research aspects surrounding the future of precision oncology. And I will share an overview of today's programming on the next slide. Once again, we are welcoming a large and a diverse audience to this event. Though some of today's programming is a little bit more technical than compared to yesterday, there is truly content within our programming for everyone, and we welcome participation from all audience members, regardless of your personal or professional background. So today we will once again begin with the President's welcome, as well as a patient story. Next, my colleague and I will share the findings of CRAN's National Clinician Survey on CGP utilization and utility. Before the break, we'll host a lab-based panel discussion. And then we will be back with our clinician roundtable, wherein leading oncologists will speak to the promising therapeutic benefits of a genome-first approach and react to the CGP cost-benefit analysis presented yesterday. After that, we're hosting a panel discussion exploring novel avenues of immunotherapy. Following the second break, we will host our last panel discussion of the conference, which will be on artificial intelligence and its application in the management of metastatic cancer, before we wrap up the conference with two presentations. The first on radioligand therapies, and we'll be exploring a different type of biomarker in that session. And the second on the value of public-private partnerships. We will close the conference with an expression of gratitude and closing remarks from our President and CEO. On behalf of CRAN, I will once again express our gratitude to the 2025 Biomarkers Conference Steering Committee. Again, these experts have graciously, expertly, and very thoughtfully guided the development of the conference programming. We are so very fortunate and privileged to have been able to work with some dedicated and passionate thought leaders who assist us in our mission. And without these experts, our programming certainly would not be as compelling as it is. So thank you very much to the expert steering committee. CCRAN is extremely grateful to our 2025 conference sponsors as well, who support the improvement of cancer care in Canada. Thank you to our platinum sponsor, Merck, our gold sponsors, AstraZeneca, Johnson & Johnson, and Roche Foundation Medicine, our silver sponsors, Astellas, Boehringer Ingelheim, Eisai, GSK, and Pfizer, and our bronze sponsors, Amgen, Bayer, Bristol-Myers Squibb, Coulson Contracting, Lilly, and Novartis. Thank you to these organizations, as well as thanks to the individual partners within these organizations with whom we have the pleasure of connecting with. We are so grateful and so humbled to collaborate and partner with a number of patient organizations who come together with one collective, resounding voice to amplify key messages and expand our networks. This year, we are grateful to our colleagues at the patient groups depicted on the screen. They have supported the 2025 Biomarkers Conference, either through a speaking engagement, through dissemination of our clinician survey, through support of the CGP cost-benefit analysis, or simply just helping to spread the word about the conference. We know that change is more impactful when we work together, and we are quite privileged to have the opportunity to work so collaboratively with these groups and many more. So just a few housekeeping notes as we get started. The agenda and the definitions are available throughout the conference by clicking the downloadable resources button, which you see below your video stream. You can also visit our conference website at any time, and there you can see our speaker bios, you can learn more about the programming, you can learn more about our partners. All viewers are automatically muted throughout the conference, and all sessions are recorded, and you will receive the recordings again next week. We do encourage your engagement throughout the sessions, and we welcome you to submit questions or comments just using that comment bar again below the video stream. We will address as many questions as possible live with our experts. And for those questions where we may not have the time to be able to address live, we will endeavor to follow up after the conference regarding questions that we didn't have that opportunity to address. Finally, should you require any technical assistance, it will be provided by our web hosting server Resolve via the help button that you see in the bottom right-hand corner of your window. Their team will make sure you can get back to learning with us as quickly as possible. I will highlight it as well specifically for metastatic colorectal cancer patients, our My Colorectal Cancer Consultant online tool, wherein you can receive a comprehensive personalized report explaining your potential treatment options based upon your tumor's biomarker status and characteristics. Thank you so much for your social media engagement yesterday. We'd really love to keep the conversation going today on our social media platforms. Please share with us your highlights, your thoughts, and your key takeaways online and tag us at CRAN.org. As well, we will be requesting your feedback in the form of a post-conference evaluation, which will be emailed to all registrants following the event, and we'll be sharing a QR code linking to the evaluation survey at the end of the day as well.